When we ignore HIV, we sacrifice our children. Welcome to Soft Girl Era, the sacred space where strong Black women unlearn survival, rediscover softness, and reclaim the joy, rest, and freedom they deserve without guilt, without apology, and without explanation. I'm your host, LeAnne Dolce, pronounced Dole, like sweet softness whispered in French, and I'm your guide from burnout to boundaries, from doing to being, from strong to soft, and loving every second of it. Today, I had the profound honor of sitting down with Jacqi Merritt, a woman whose life's work is nothing short of revolutionary. Jacqui is the founder of Thinking Positive, a movement that refuses to let another generation of Black children lose their childhood to a virus we can prevent, treat, and stop if only we face the truth. Her mission is simple but earth shattering: get tested, because AIDS doesn't just affect the carrier, the kids get hurt too. What Jacqui shared with me during our conversation will shake you, move you, and I hope inspire you to take one bold action that could change a child's life forever. Let me be clear: we're not here to talk about HIV as some distant statistic or someone else's problem. We're here because right now, in our communities, Black children are carrying burdens they should never have to carry, losing childhoods they'll never get back, and living with trauma that will follow them into adulthood, all because the adults around them didn't get tested. And that stops today. Here's what most people still believe: HIV is an individual problem, it only affects the person who tests positive. That belief is not just outdated, it's dangerous. And it's killing our kids, not always physically, but emotionally, psychologically, financially. When we ignore HIV, when we avoid testing, when we let stigma and shame keep us silent in Chesitsa, we are not just risking one life. We are sacrificing the safety, mental health, and future of every child connected to that life. Jacqui helped me see this truth in a way I'll never forget. HIV is a family disease. It lives in households, it reshapes childhoods, it forces children into adult roles long before they're ready. And in Black families, where we already carry the weight of systemic racism, poverty, and unequal access to care, HIV doesn't just touch one person, it devastates entire networks of love, support, and survival. Let me share three insights from my conversation with Jacqui that every Black professional, leader, and entrepreneur needs to hear. First, it's HIV is a family issue, not a solo diagnosis. In the United States, almost all children under 13 living with HIV acquired it perinatally, meaning from pregnancy, birth, or breastfeeding. And here's the part that should stop us in our tracks: Black children make up 56% of children under 13 with diagnosed HIV. Despite Black people being a minority of the population, 56%. When you think about HIV, you must picture the children: sons, daughters, nieces, nephews, whose lives, schooling, and mental health are directly impacted by whether the adults in their lives get tested and stay in care. This is not about blame. This is about protection. When a mother doesn't know her status, when a father avoids testing, when a caregiver lives in denial, the children pay the price. Second, when today's children carry invisible burdens when a parent has HIV. Research on women living with HIV describes loss of control, deteriorating relationships, and limited access to education and work, especially for girls who are expected to fend for sick parents without adequate support. Jacqui's work mirrors this reality. Children of parents with HIV become unpaid caregivers, emotional shock absorbers, and economic safety nets, often while dealing with trauma and stigma that no child should ever face. They miss school to take care of siblings. They hide the truth from friends because they're ashamed. They grow up too fast and they carry guilt that isn't theirs to carry. This is the hidden cost of untested, untreated HIV in Black families. And it's a cost our children should never have to pay. Third, testing and family centered care protect children's futures. A study from sub Saharan Africa showed that when mothers are on antiretroviral therapy and have suppressed viral loads, their children living with HIV are far more likely to be on treatment and have viral suppression themselves. Other pediatric HIV research highlights that children's medication taking, clinic attendance, and treatment success depend heavily on household capacity, caregiving dynamics, communication, and stigma. Getting tested, staying in care, and creating stigma free environments are direct investments in children's stability and long term success, especially in Black families disproportionately affected by HIV. This is not just self care, this is child protection. Now, let me share three stories that bring this message home. Stories that reveal the true face of HIV in Black communities and why Jacqui's work is so desperately needed. The first story is about the disproportionate impact of HIV on Black children in the United States. This isn't a single family story, this is a population level crisis. Almost all children under 13 living with HIV acquired it from mother to child transmission, and Black children account for the majority of these cases. The challenges are clear. Perinatal transmission shows that children's illness is directly tied to whether their parents are diagnosed and treated. Racial disparities reveal that Black children represent 56% of children under 13 with diagnosed HIV. And systemic barriers, structural racism, and unequal access to prevention and treatment compound risks for Black families. But here's the hope: early testing for pregnant women and routine HIV testing during pregnancy, linked to antiretroviral therapy, dramatically reduces the risk of transmitting HIV to infants. Family centered prevention, integrating maternal and pediatric HIV care, and prioritizing Black communities in prevention programs like PrEP access and stigma reduction is key to improving outcomes. And policy and community interventions that reduce poverty and improve access to care have been shown to lower HIV incidence and AIDS related deaths in marginalized communities. The outcomes are powerful. In places where maternal testing and treatment are widespread, rates of perinatal HIV have dropped substantially. Areas that reduce poverty saw large reductions in AIDS cases and AIDS deaths, showing that when we support families structurally, children benefit directly. This story demonstrates that Black children's risk of HIV is inseparable from adults' testing and treatment behaviors. When adults fail to test or engage in care, the children get hurt too, not only through infection, but through disrupted schooling, caregiving burdens, and grief. The second story focuses on maternal engagement in HIV care and children's outcomes in sub Saharan Africa among Black families. Researchers examine children living with HIV and their mothers, focusing on how a mother's engagement in HIV care affects whether her child receives treatment and achieves viral suppression. The challenges are sobering. Children living with HIV had lower rates of antiretroviral therapy uptake and viral suppression than adults. Children of mothers aged 15 to 24 had particularly low treatment uptake and viral suppression. And household strain, young mothers coping with poverty, stigma, and limited support, made it hard to consistently manage their own and their children's care. But the solutions are clear. When mothers were themselves on antiretroviral therapy and had suppressed viral loads, their children were much more likely to be on treatment and virally suppressed. Children whose mothers were receiving treatment had significantly higher odds of using treatment themselves. Children of mothers with viral suppression had higher odds of viral suppression, primarily because they were more consistently on treatment. The researchers recommend integrating maternal and pediatric HIV care, treating mother child dyads together, and supporting mothers as key gatekeepers to children's health. The outcomes are undeniable. Parents' engagement in care protects children's futures. Maternal treatment and suppression directly improve children's treatment uptake and health. Testing and engagement are not just self preservation, they are acts of caregiving. This story allows us to say when a mom knows her status, stays in care, and takes her meds, her child has a far better chance of living, growing, and dreaming. Getting tested is not just about your life, it's about your child's life. The third story examines psychosocial and caregiving dynamics in pediatric HIV in South Africa among Black children. Researchers investigated children and adolescents living with HIV, focusing not just on clinical markers like viral load, but on psychosocial conditions surrounding their treatment, caregiving, communication, and stigma within families and clinics. The challenges are heartbreaking. Globally, in 2024, an estimated 1.4 million children aged 0 to 14 were living with HIV, and only 47% had suppressed viral loads, compared with 74% of adults. Children depend on caregivers for medication taking, clinic attendance, and understanding their illness. And communication about HIV, missed doses, and adherence is shaped by family dynamics, fear, and stigma, which can prevent honest conversations. The solutions require attention to psychosocial context. Severe virological failure in children is influenced not just by clinical factors, but by psychosocial conditions, particularly how adherence difficulties are recognized and discussed. Improving caregiving relationships means recognizing that routine adherence indicators, like reported missed doses, actually reflect the quality of communication and caregiving dynamics, not just behaviors. For families and providers, and this means supporting caregivers, addressing stigma, and creating safe spaces for disclosure and honest conversation. The outcomes highlight that children's HIV outcomes are tightly bound to the emotional climate at home and in clinics, especially for Black kids in high burden regions. Even when medication is available, if family dynamics are abusive, secretive, or highly stigmatizing, say children's health can deteriorate. This story allows us to say when a parent is sick, stressed, or ashamed, the children absorb that energy. They become caregivers, they hide the truth, they carry the pain. If we really want Black children with HIV, or with a parent who has HIV to thrive, we have to heal the household and not just treat the virus. So, what would happen if more people and organizations adopted Jacqi Merritt's perspective? If we embraced this family centered, child focused approach to HIV. Higher testing and treatment among adults would mean fewer children infected and fewer disrupted childhoods. When mothers are tested, treated, and virally suppressed, their children have much higher odds of being on treatment and achieving suppression themselves. Widespread testing and maternal care would further reduce perinatal transmission, directly lowering the number of children born with HIV. We would see reduced racial disparities in pediatric HIV among Black children. Black children currently represent 56% of diagnosed HIV cases under 13 in the United States. If Black communities shift to a norm where testing is seen as protecting children, not just adults, this could improve early detection, treatment, and prevention, weakening the structural link between racism, poverty, and HIV outcomes. We would build stronger, more resilient families and better mental health for children. Data show that children's outcomes are shaped by caregiver engagement, stigma levels, and communication. Organizations that support mental health, family counseling, and trauma informed care for families affected by HIV would reduce the kind of hidden trauma that too many children live through. Parentification, abuse fueled by stress and self hatred, and coping mechanisms born from pain. And we would see a cultural shift, HIV testing as an act of love and leadership. In Black professional and business spaces, adopting Jacqui's perspective would normalize HIV testing as part of responsible leadership, like financial planning or estate planning. You do it to protect the children around you, not only yourself. I want to leave you with this: AIDS doesn't just live in one person's body, it lives in the lives of their children. Jacqui Merritt is proof that when we face the truth, when we get tested, when we choose courage over shame and honesty over silence, we protect the next generation. So here's my challenge to you. If you love a child, any child connected to you, get tested for HIV. Don't wait for symptoms. Don't assume it's not your issue. Make HIV testing part of how you protect Black children's futures. Within the next 30 days, schedule an HIV test for yourself and, where appropriate, encourage partners to do the same. If you are a leader in business, church, or community, open one honest conversation about HIV as a family issue, emphasizing children's protection, not blame, because no child should have to carry that burden alone. And one test, one conversation, one act of courage can change everything. The question is not whether you care about Black children. The question is, what are you willing to do to prove it? Get tested, start the conversation, save a childhood. The time is now.